I'm David Lombardo, and this is WCNY's The Capitol Press Room. An independent evaluation of the state's utilization of court-mandated outpatient treatment for mentally ill New Yorkers raises questions about the efficacy of this approach authorized under Kendra's law, including whether the harms outweigh the benefits compared to the experience of individuals who receive similar mental health services voluntarily. Over the last quarter of a century, the program has impacted about 24,000 New Yorkers. For more on the analysis, which was pushed for by the state legislature and ultimately found that the state should do more to promote voluntary services, we're joined by Dr. Miriam Tepper, Chief Medical Officer at the State Office of Mental Health. Thanks for making the time, Dr. Tepper.
It's great to be here with you, David. Thank you for having me.
Well, these findings seem to be sort of a Rorschach test, with the reception of the report kind of shaped by how people already think about court-ordered mental health treatment. For example, opponents of the practice look at this report as conclusive evidence that coerced treatment is a net negative. Did you come away thinking the status quo is a net positive, or that there should be changes in the state's approach to treatment for that hard-to-serve population that has basically turned down a whole host of voluntary services?
Yeah, we really think that this report shows that assisted outpatient treatment is accomplishing really what it set out to do: reduce hospitalization and improve public safety. What this report did was compare two different populations: a group of people receiving assisted outpatient treatment, who are people who have already not agreed to participate in voluntary services, and then as a result had really significant safety risks, either danger to themselves or others, or repeated hospitalizations or incarcerations. So that's the one group. And then it compared that group to people who were receiving voluntary services. And what it found is that both groups improved across a range of outcomes, but actually the people under assisted outpatient treatment did better than the group receiving voluntary services in a few really key areas, including reduced risk of harm to others, fewer and shorter hospitalizations, and better housing stability. In those really key areas, the people receiving assisted outpatient treatment actually did better than people receiving voluntary services. And we really take that to demonstrate that there is some unique advantage that assisted outpatient treatment provides for this very small group of people who are eligible and appropriate for it, over and above voluntary services. And the findings seem particularly noteworthy since improving community safety and community stability were really underlying the creation of Kendra's Law 27 years ago now.
Well, thinking about something like housing stability, it's my understanding that this population that is served by the assisted outpatient treatments is essentially prioritized when it comes to housing in the aftermath of their care, as opposed to those who are in the voluntary programs. What do you think of that analysis, and does that make the case that we should be just prioritizing those voluntary people maybe more than the people in the assisted outpatient treatment, or that if they were prioritized equally, they might see the same type of housing outcomes?
Well, all people are offered voluntary services, and people receiving the type of voluntary services that were studied here actually are also prioritized, because they're another group of very high need people with complex mental health needs.
So do you disagree, though, with the assessment that the population that is served by the assisted outpatient treatments, as opposed to the voluntary agreements, are not prioritized over those people with the voluntary agreements? Because that's the concern by some in the space.
Well, we do support prioritized access to services for people with high level of service needs. That's an appropriate way to, we think, to allocate resources and to be really sure that people with the greatest levels of needs are getting access to services, to really needed services. And so that's, I think that's a general approach that we do support.
So I want to come back to the purpose of Kendra's Law, which is this statutory framework for court-ordered outpatient treatment, and it's supposed to be serving those people where it's a measure of last resort, these people who have refused to follow treatment plans or refused a whole host of services. But this new report cites dozens of New Yorkers who claim they were desperate for assistance. So do these anecdotal accounts make you rethink when court-ordered treatment has been utilized in recent years, or that you need to rethink outreach efforts to promote voluntary treatment? Or do you just reject these anecdotal accounts of people who say, yeah, no, I wanted services. I didn't want to be forced into a court-ordered treatment?
Well, to be eligible for assisted outpatient treatment, people have to have already been offered and not participated in voluntary treatment. So that's a really important point, is that it's not possible to receive assisted outpatient treatment unless they were offered and did not participate in voluntary services.
And so how do you know, though? I mean, can you talk about how you track a person's interactions and how you know that they've been offered a whole host of opportunities and that they've had them maybe explained to them in a way that maybe is understandable about what the services might look like and what the alternatives might be?
Well, it's part, as you pointed out, as part of the statutory framework. So that's the legal basis that it is. In order to be eligible for AOT, a person has to have been not participating in voluntary services. And there's a wide array of voluntary community-based services available throughout the state, and even more so coming online now through the governor's tremendous expansion of community-based mental health services, particularly for those with complex needs.
But how do you know that those people have been offered all of those opportunities before the court-ordered treatment? How do you know that they've turned everything down, that this is a last resort? Is there a way that you're tracking people's interactions with the mental health system?
Well, I think that's a determination. I mean, that's up to the judge, really, to make that assessment.
So you don't have people who are saying to a judge, hey, this person has been offered this treatment at this point, they've gone through this service plan, but unfortunately they didn't complete it. I mean, what is the documentation on these individuals? Because there are people who are saying, I was desperate for assistance. I wanted help, and I got forced into this type of treatment.
Well, I think what the report, what some of the anecdotes, the quotes in the report point out, is that there are a lot of good opportunities here for improving the delivery of the service, and we are really open and open to feedback and open for opportunities to improve this really important program. It is very important that people are informed throughout the process and understand their rights and understand the process itself and afforded opportunities for their voice to be heard throughout that process.
Well, yeah, let's talk a little bit more about what the future implementation of this looks like. But first, let me reintroduce you for listeners just joining us. This is WCNY's The Capitol Press Room. I'm David Lombardo, and we're speaking with Dr. Miriam Tepper, Chief Medical Officer at the State Office of Mental Health. So the report ultimately finds that the state should do more to promote voluntary services. So what does that look like in terms of actually doing that in the real world? Is that something, one, that you agree that there are opportunities to promote them more? And two, if you do, what do you think is an area for improvement?
So one thing I would just point out is that assisted outpatient treatment exists for a very small proportion of the full population receiving outpatient services. It's 0.5% of the more than 800,000 people receiving community-based services.
So about 4,000 people?
Mm-hmm.
Okay.
And so, the one of the goals of the recent investment in funds is investment in this program is to standardize and expand the use of enhanced voluntary agreements, which are a voluntary service plan for people to be receiving services in the least restrictive setting and least restrictive context. And so we have invested a lot in supporting infrastructure around that and helping counties standardize policies and procedures around these voluntary agreements and really expanding their use.
When we think about standardization of these voluntary agreements, what are some of the key tenets that you think need to be part of any of those approaches to make sure that it is meaningful? Because like you said, not every county has one of these. You could maybe have various approaches to this type of work. So what are the key tenets to a successful voluntary agreement program?
Well, part of what we are doing with this expanded approach to the voluntary agreements is to reduce the variation between the counties. So all counties were able to hire a staff person to really support coordination of care for folks with complex needs, to help make sure that voluntary agreements are done according to sort of some set standards and consistent with the mission of what the voluntary agreements are meant to accomplish, and really to reduce that geographic variation that you were pointing out.
Are there any counties you think that do a particularly good job when it comes to defining and implementing these voluntary agreement programs?
I can't comment on specific counties. There is a lot of variation, or there has historically been a lot of variation, but the Office of Mental Health is coming out, or has come out recently with some expectations for what those might look like, to try to bring more consistency to the process and really expand their use, because I think voluntary, if things can be done in a voluntary way, that's better.
One of the things the report highlights about the implementation of Kendra's law is that it is dramatically, disproportionately used on people of color. I think 4 out of 5 in New York City. Why do you think there are those racial disparities in terms of who ends up in coerced treatment?
Yeah, there's no doubt that there are underlying systemic issues that have resulted in disparities in care for historically marginalized populations. And our really important role here is making sure that we do not perpetuate those disparities. And so we have a real big role in training staff to recognizing their disparities, recognizing their own biases, and making sure that they are able to provide culturally responsive services to people and really promote equity and, really importantly, not perpetuate those existing disparities.
Do you see racial disparities amongst all of the people authorized to implement Kendra's law, or is this something that is disproportionately a problem with law enforcement, which historically has had racial discrepancies in their policing approach?
Yeah, I'm not sure. That's a good question.
Okay. Well, we're going to take a quick break, and when we get back, we'll have more with Dr. Miriam Tepper, Chief Medical Officer at the State Office of Mental Health. When we return, we'll talk about the potential for reauthorizing the underlying statute, Kendra's Law, which created a statutory framework for court-ordered outpatient treatment. And we'll talk more about implementing some of the reforms recommended in the report. Support for the Capitol Press Room comes from O'Donnell & Associates, a public affairs firm providing strategic guidance to businesses and nonprofits on navigating policy and regulatory issues. More information is available at o'donnellsolutions.com. This is WCNY's The Capitol Press Room, and we're continuing our conversation about an independent evaluation of the state's utilization of court-mandated outpatient treatment for mentally ill New Yorkers, which raised questions about the efficacy of this approach and recommended the state ultimately spend more money and time on promoting voluntary services. Our guest is Dr. Miriam Tepper, Chief Medical Officer at the State Office of Mental Health. In addition to calling for an expansion of voluntary services, the report calls for expanding due process protections. What are your plans for the implementation of that?
Yeah, the report lists an extensive list of recommendations from some very straightforward kind of suggestions, all ranging up to much broader recommendations that are multi-agency, cross-systems kinds of changes. And we really support. We have a purview over some of them, and certainly not all of them. But we really support. We're really excited to be looking at these recommendations very carefully and seeing what we can partner with others and really move forward based on what's feasible. But we, really value our relationships with other stakeholders in this space, and we'll want to be partnering with them in whatever ways possible.
Well, can you expand a little bit more on what the review process of this report will consist of?
Yeah, we are looking very carefully at the report. It highlights, it brings up some really important suggestions, and we really welcome the feedback and, as I said before, opportunities for improving this program. We welcome the partnership with others and input from stakeholders as well to do whatever we can to improve the quality of this program and really implement recommendations that are feasible.
Kendra's Law, that underlying statute, is set to sunset next year. Do you think this report makes a case for permanently extending Kendra's Law, extending it with a sunset again, changing the underlying statute, or getting rid of it completely?
We do really feel that this report supports the continuation of Kendra's law. We really feel it is, for this very small group of people for whom it is appropriate, it is a really important tool in the toolbox, and we want to be sure that it continues to be available for those who need it. So we do hope that it will be renewed in the upcoming year.
And are you looking for a straight renewal, or do you think that there are changes that need to be made to the underlying law, in part to actually make some of the changes that are recommended in this report?
That's a very good question. I know it's been renewed every 5 years since it's been in place, and I think that's something we're going to have to think a lot about.
Well, is it your understanding then that you can make all of the recommendations that are in this report, or at least all the ones that you want to make, without changes to the underlying statute? Can the OMH and other state agencies that are impacted by this use their existing statutory authority to make the relevant changes?
Well, I think not all of the recommendations included in the report are going to be feasible, but I think that the things that are feasible, I think, could be accomplished within the current statutory framework.
What of the recommendations do you feel like aren't feasible?
There are some very broad recommendations requiring, some of which require extensive changes in other agencies and other within the legal system that really aren't under our purview to have a lot of impact on
So
by
they're
ourselves.
feasible, but just not something that you guys could administratively do. If there was will
things
amongst
that we're going to need to really look at really carefully.
Okay. Well, before we move on, let me reintroduce you for listeners just joining us. This is WCNY's The Capitol Press Room. I'm David Lombardo, and we're speaking with Dr. Miriam Tepper, Chief Medical Officer at the State Office of Mental Health, who's weighing in on an independent evaluation of the state's utilization of court-mandated outpatient treatment for mentally ill New Yorkers, which raised questions about the efficacy of this approach and called for the state to increase its time and energy promoting voluntary mental health services. Well, I want to come back to the underlying work here, because in the press briefing, the mental health commissioner described you as a data expert. So given that backdrop, what do you think of the report's approach to analyzing this issue? Because this is a complicated topic. You don't necessarily have control groups. You're extrapolating across the history of the program. You're taking anecdotal accounts from some people, looking at certain broad data sets. So do you have any problems with the way the numbers were crunched, so to speak?
Yeah, so I mentioned before that the evaluation compares these two groups, right? One of whom have not been able to participate involuntarily and as a result really posed a safety risk, and another group of people who were on their own agreeing to voluntarily participate in services. And as you can imagine, those are two very different groups of people.
Sure.
And so the folks who did this evaluation used some fancy statistical tools to try to make the comparison as fair as possible.
Now, when you say fancy, do you mean they're wearing like black tie while they do it? Or?
It's just some complicated statistics that were, an appropriate way to assess to try to compare these groups as much as possible. But there is this underlying difference between them, that one group of them are voluntarily accepting services and one cannot, and that isn't something that can be statistically managed. So I think the tools they used were really good, but there are some fundamental differences between these groups that may not have been able to capture through those statistical tools.
So even with those limitations, though, this has been pretty widely acknowledged as a very interesting report at the very least, and kind of unique in the landscape in terms of the depth which it examined this issue. So moving forward, given the fact that the underlying statute is one that is typically renewed for like a 5-year basis, is there a case to be made for continually requiring some sort of evaluation like this? Because this is an outside review. It's something that the legislature asked for. So is there a case to be made to continue to have an outside set of eyes looking at this from time to time?
I think that's really up for the legislature to decide. I think we definitely agree in ongoing evaluation of all of our programs, and that's something that we're really, that I'm particularly interested in, is really understanding the impact of everything we do, making sure that it is effective and having the kind of impact that we want. And so I think there are different ways of accomplishing that. But there are lots of really important programs that the state is funding that really merit evaluation.
Well, without an independent review like this one, how does the State Office of Mental Health go about evaluating the assisted outpatient treatment experience from implementation to ultimately its impact on people? What have you historically done over the last quarter century, and what do you plan on doing in the future to judge whether this is a working program?
Well, we have long tracked various elements of the assisted outpatient treatment program, and we are just now really excited to have modernized the database that we're using for tracking participation and coordinating better with counties and ensuring that concerns can be addressed in real time. So we are definitely looking forward to this next phase of having clearer data at our fingertips so that we can be even more responsive.
And thinking about these services in the context of the broader mental health landscape, at the federal level, there is less of an emphasis on community-based setting help for people, this idea that they want to put more people into these outpatient treatment facilities, institutionalized care. Is that going to impact your work at all in this area, or is that something separate and apart from what you're doing here and the state's general commitment to serving people in the least restrictive settings?
Oh, yeah. We're laser focused on serving people in the least restrictive settings possible, providing a real diverse array of supports to meet people with diverse needs and preferences, and we stay really true to that commitment.
Well, we've been speaking with Dr. Miriam Tepper. She's the Chief Medical Officer at the State Office of Mental Health. Dr. Tepper, thank you so much for making the time. I really appreciate it.
Thank you so much for having me.
Support for the Capitol Press Room is provided by New York State United Teachers, a statewide union of nearly 700,000 professionals in education and healthcare.